Opportunistic infection, we can diagnose. We can say that the patient is HIV, he has AIDS. But if we say, we can say by looking at the low count of the T cells in the blood, we can say that he has AIDS. So there is no specific criteria diagnosis or any other HIV. But it's still someone may be very with HIV but not have an AIDS diagnosis. Okay, there is a WHO question for to know how can we diagnose and treatment. So WHO has made classification for us. And that of the board
Okay. Okay, I had this viral and immunological progression of HIV, a graph for it. So after she's finished with this, I'll do that. Okay, then come on.
Do you guys want to ask questions on whatever she has said? Are you guys clear?
Irfan.
I'm not clear about what is seroconversion.
Seroconversion is the stage cell bodies are produced. Like cell bodies and cytotoxic lymphocytes are produced HIV infection. And when these are produced, these can test in the blood. And for antibodies,
it's the HIV. So, I mean, which antibody is the IgG?
Because IgM cannot. It should not be detected that person is HIV positive.
Okay, and next we have the transmission of AB 470.
Transmission is basically via three routes: sexual transmission, and then via body fluids, and thirdly the vertical transmission. In sexual transmission, it is transmitted via the sexual secretion, the mucosa, rectal mucosa, genital mucosa, or oral mucosa. We can prevent it by having a protected sex and to avoid unprotected sex. US government and health organization has given ABC approach for prevention via sexual contact. That is, A is abstinence or delay for sexual activity, and B is for being faithful, especially for the committed relationships, and C is for condom use, especially for those who are engaged in risky.
Did you get the ABC below? Can you repeat that?
A is for abstinence, B is for
Faithful, being faithful.
and C is for using condoms for purpose.
And one thing for the condoms, that for the male latex condoms, they should not use oil lubricants with that, because oil lubricants dissolve latex material, so that will increase the risk of transmission. Yeah, oil lubricants with polyurethane condoms. That can for latex condoms, water-based lubricants can be used. So for sexual transmission, condom is a helpful thing to prevent transmission of fluids. The other thing is exposed fluids, that is especially blood, because saliva, urine, and other secretions have HIV, but they do not have the effective dose for causing AIDS. So we can prevent this transmission through body fluids by doing screening before blood transfusions, using new syringes every time for drug abusers, and cutting the syringes after use of syringe. And then we have the medical workers should wear gloves before doing any procedure like giving injection or dealing with blood or stuff like that. And third mode of transmission is vertical transmission, that is from mother to child. That occurs during the last weeks of pregnancy. So we can prevent it by doing the cesarean section and giving antiretroviral therapy to the mother. That can reduce the risk. Without antiretroviral therapy, the chance of entry of getting AIDS is 25%. But by doing cesarean section and giving antiretroviral therapy, the chance is reduced to 1%. So that is helpful. Other common tips are that people should wear gloves with the body, say the medical workers or the patient. If one person have cuts or sores, it should be covered with bandages.
What about, you say, you didn't mention transplacental and perinatal sepsis, like either an increased likelihood of perinatal and you use while and also you didn't mention
should be used replacement feeding. There should be replacement feeding, like other ways of feeding other than the breast feeding. And
you breastfeed.
I don't know about the exact percentage. I just read that there should be replacement feeding.
Does anyone know how much?
12%. 12%.
12%.
Increase?
risk?
For the Mark is 20%, and then it comes down to 5 if you don't breastfeed.
And other tips are that do not share the objects like razors, toothbrushes, toggles that may transmit the disease. And there is one misconception that food service workers transmit AIDS. This is really a misconception because there is no way of transmission unless you have a blood contact or sexual contact. So they might be allowed to work in food services.
So household contacts are safe or unsafe? Safe.
Okay. Any questions? Any questions, anyone?
On transmission, I don't know anything that you missed.
Okay, now.
Everyone gets the routes of transmission. Are you clear about that? Or are you clear?
Okay, and now we have the signs and symptoms. Bilal?
Okay, as far as the signs and symptoms are concerned, we have classified them into 3 basic stages. First is the early stage, then comes the acute stage, and then is the late immunodeficiency stage. Now, the early stage comprises the time period before 2 to 4 weeks after the initial infection, and the acute stage involves the time period after 2 to 4 weeks infection, and the late immunodeficiency stage comprises like after 6 months to 1 year and so on. Okay. Now, in the early stage, the patient usually does not show any signs and symptoms. In the early stage, that is before 2 to 4 weeks after the HIV virus has infection. In the acute stage, that is after 2 to 4 weeks, the patient shows signs and symptoms which include fever, lethargy, sore throat, generalized lymphadenopathy, and some of the patients also develop maculopapular rash on the legs and the arms, except and the trunk as well, except the
arms and the soles.
Okay, and there is also leukopenia, but the CD4 count is normal. Okay, at this time, and there is also viremia, obviously the HIV virus, and infection is transmissible at this stage. Now after 2 to 4 weeks, after this acute stage of infection, then comes the resolving phase, in which fever, lethargy, and sore throat is all resolved, and viremia level is also reduced, and there is increased CD8 level in the blood. And then comes late immunodeficiency stage, which includes all the opportunities like pneumocystis and tuberculosis.
And when was this?
Infections. Now, as far as
when was this, Bilal? The late immunodeficiency stage?
Huh?
When was this late immunodeficiency
6
stage?
months to 1 year sort of thing.
After the infection?
After the infection. Late immunodeficiency stage.
Okay.
When the patient develops some opportunistic infections as well.
Isn't it like after many years that the CD4 count falls and the immunodeficiency stage?
No, that's the least reported. 6 months to 1 year.
Okay, minimum.
Now, in the light of the scenario, it is said that the patient had a road traffic accident 2 years ago. So that means that the patient must have had, is in the late immunodeficiency stage, and must have had some opportunistic infection, as the scenario says that he is a non-smoker and he is suffering from cough and hemoptysis as well. So, and he is anorexic and clammy with a raised temperature. So, in the light of the scenario, what I feel is the patient is suffering from immunodeficiency, late immunodeficiency.
So, which ones of in the late immunodeficiency stage you said that there are some opportunistic infections?
Opportunistic infections like tuberculosis, rectal infections, fungal infections. According to Matthew, is that the patient is complaining of cough and non-smoker. They have mentioned this, and he has noticed some weight loss, and he is anorexic and clammy with a raised temperature.
Okay.
Did you find out family? Yeah, what's that?
There is excessive perspiration, yeah, decreased temperature. Okay.
So, Bilal, can we say that AIDS itself is asymptomatic, and it only shows by other diseases like tuberculosis or some other?
No, it is not asymptomatic, as it shows some symptoms like your face, like lethargy and
sore throat and fever.
That is HIV infection is basically AIDS.